Hi, hello. I would like to first greet all of you or those people around here who may come across this video. Honestly, I'm not being posted anything since this lockdown started. So you might be wondering why I posted a video post instead of a normal post in this social media in Facebook. The reason is that I wanted to challenge a little bit myself this time and post a video or a blog instead. The reason for this video is really to create awareness of the what is currently happening right now. It might be late to give my views and opinions considered as relevant because the current situation that we have right now is still with related to the crisis that we all face, and that is the reason why I'm posting this one. Um, we all know that we are here currently in this time of the lockdown, as we call it. The other term here, for not only here in the Philippines, but I think for almost all the countries in the world right now who is currently affected by this due to this lockdown. We are restricted, and there are some our movements are limited within the premises of our home, and had effect on the aspects of in terms of our health. I might focus on the three aspects which is mainly affected by this the lockdown. I know for sure that we all really know what's the cause of all these things that is happening right now, and that is primarily because of one virus, just the novel coronavirus or the COVID-19. It's a it's, as far as I know, it's a strain of a coronavirus that is really contagious, which could spread and could transmit through means of droplets, respiratory droplets from a saliva of a person through maybe cough or sneeze, a simple sneeze. And even when you when making conversations, at least maybe the vapor of the air from the saliva that comes out from the mouth of a person, of an infected person, I mean, so sure. And the health authorities already informed the public through the social media and other means of information, and the precautions being given are the frequent hand washing, social distancing when we are in public places, and proper sanitation, and alcohol-based product like ethyl alcohol or these isopropyl 70%. The world right now is currently, I think the data has already been picked to around 5.4 million so far, the world number in terms of cases of the coronavirus, and the deaths have come to around, the death toll has 344,000. Now, going back to the topic that I want to emphasize, which is the overall health of a person, because primarily we are really concerned about our health during this time, since we are in the midst of a pandemic, in the crisis of the coronavirus, when we have to really take care of our health and maintain it as far as we could do, especially in our immunity, since it's really important that we could boost our immune system in order to fight against common colds or even other diseases that come across, because this virus may be triggered if we have other issues in our health, like we have the common colds, and our immune system would be weak. So it might be if we could encounter a person, or we could came contact across a person which is infected, then there's a 90% possibility that we could acquire the disease. I mainly focus on the three areas, which is the physical side and physical aspect of the person, health of person, the mental aspect of the person, and the emotional aspect. So these three are things that we should consider in order for us to have that well balanced system, and we could consider our health as at at least one could which one that could be considered as tough enough to handle such disease or the virus. The physical, in terms of the physical, I think people are tend to be less of a have having the less activity nowadays because we are at the lockdown period, and that's the bad side of it. Because as far as I know, as far as I could see, people are tend to be sitting most of the day, um, be talking, or if we are doing the household chores, then we could go to normal works in the house like cooking, washing the clothes, cleaning the house, and that's not it might consume some of the energy that we have, but it's not as good as maybe walking around or strolling around that we used to do before the lockdown period, or some of it like the fitness enthusiasts, the people who are regularly going to the gym, and since the gym is not available during these days, we could have some alternative in doing that. Because as far as I know, people are tend to be just sitting around the corners of their home and just scanning around their phone, watching social media updates, um, watching the news, watching the what's in the YouTube, doing TikTok as far as the other people are concerned. And what's that? The bad side is we are not consuming enough. We are not consuming enough energy, and we're not burning calories that we are taking in. Because normally we used to burn those calories with the physical activities that we do. Physically, we burn these calories, and we try to burn the extra calories and break down the fats in our bodies through physical activities like walking or jog or doing the work that we do. But since during this lockdown we are limited in our movement and we're staying at home, so we can do other activities. So we should watch it and try to make at least 30 minutes or 30 minutes a day is good enough, because as far as the recommendation is concerned, I think the World Health Organization recommended 150 minutes of moderate physical activities just to maintain the health. That's the minimum requirements they do. And I also scan over the Department of Health recommendations over what activities, physical activities, or the duration of it that is required. It's 15 minutes at least a day, or at least if you do it 6 times a week, the recommendation is still 150. So you can divide it into 5 days with 30 minutes, or you can divide it to 15 minutes for 6 days or the whole week. But you have at least a day of rest, just to recover, because recovery is also vital, just to maintain your health. And then the second aspect that I would like to talk about is the mental aspect of a person, the mental health. Nowadays we tend to be think less. We only do such things as could entertain us. I'm not talking about the people who are working right now, because I think some of the people are working at home, and some of the companies are providing their employees the same routine that they do before at work. But I'm talking about the people who are not working and then doing um, not challenging activities at home. Like if we think less and our brain are not functioning as effective as it is before with the critical thinking. And also, not considering those people who are also reading a lot and also doing something that is creative just to keep their mind active. So it's really far important also that we could do such productive activities like learning something new skill that could be done at home, or discovering some new ideas, um, reading a good novel or book, and such things are could really um, boost your thinking ability. And because if you neglect your mental health, this could also leads to other disease like the memory loss for the aged person and Alzheimer or dementia, wherein this is the degeneration of the neurons in your brain, because you used to use it before when you are working, and all of a sudden we are stuck here at home. We think less, we are just doing the normal things, the normal routines that we do at home. Now, the third aspect that I would like to talk about is the emotional aspect. So we have already discussed two of the aspect, like the physical aspect or the physical health aspect and the mental health aspect of the person that should be focused on right now.